everybody. My name is Migmalala and I am your student nurse for today. So for today's video, I will perform the Leopold's maneuver. So let's go!
Leopold's maneuver. Leopold's maneuver are 4 specific steps in palpating the uterus through the abdomen in order to determine the lie and presentation of the fetus.
So first step is we should introduce ourselves and identify our client. Good day, Mom. I am Migmalala, your student nurse for today. So are you Mrs. Santiago?
Yes.
Rationale. By introducing yourself, you make yourself approachable and put them at ease to communicate and voice their concerns. Identifying the client will reduce harmful outcomes from avoidable patient identification errors.
Next is we should prepare our client by first explaining the procedure, instruct our client to empty the bladder.
Rationale. Explaining the procedure to the client reduces anxiety and improves participation in care. Instructing the client to empty the bladder so that she will be comfortable and the contour of the fetus is not obscured.
So today, Mom, I will perform to you the Leopold's maneuver. The purpose of this is to determine the position of the fetus inside your womb. So I would like you to request to empty your bladder first. Next is let's position the client to supine with knees slightly flexed. Then place a small pillow or rolled towel under the legs.
Rationale. Positioning the client to supine with knees slightly flexed, then place a small pillow or rolled towel under the legs will promote comfort.
Wash hands using warm water and then dry.
Let's assume that we already wash our hands using warm water and dry it, because cold hands can stimulate uterine contractions.
Expose the abdomen and inspect.
Rationale. Exposing the abdomen will help the nurse to inspect and facilitate properly.
Let's assume that this is an exposed abdomen. Measure the fundal height using a tape measure, and let's assume that we already measured the fundal height of the pregnant.
Measuring fundal height will help us determine if a baby is small for its gestational age.
Perform the first maneuver. Stand at the foot of the bed facing the client and place both hands in the abdomen. Palpate the superior of the surface of the fundus. Determine the consistency, shape, and mobility.
Performing the first maneuver will help us determine fetal part lying in the fundus and to determine its presentation. The findings are head is more firm, hard, and round that moves independently of the body, while the breech is less well-defined that moves only in conjunction with the body.
Perform the second maneuver. Place the palm of each hand in either side of the abdomen. Palpate the sides of the uterus. Hold the left hand stationary on the left side of the uterus while the right hand palpates on the opposite sides of the uterus from the top to bottom. Then hold the right hand steady and repeat palpation using the left hand on the other side.
Performing the second maneuver will help us identify location of the fetal bag and also to determine its position. The findings are fetal bag is smooth, hard, and resistant surface, while knees and elbows of the fetus fill with a number of angular nodulations.
Perform the third maneuver. Gently grasp the lower abdomen just above the surfaces using your thumb and the index finger. Press the thumb and finger together Determine any movement, whether the part is firm or soft.
Performing the third maneuver will help us determine engagement of presenting part. The result are, the presenting part is engaged if it is not movable. It is not yet engaged if it is still movable.
Perform the fourth maneuver. Face the foot of the client. Place fingers on both sides of the uterus appropriately 2 inches above the inguinal area. Press downward and inward into the direction of the birth canal. Allow fingers to be carried downward and check cephalic prominence.
Performing the fourth maneuver will help us determine the degree of flexion of fetal head and also to determine the attitude or habitus. The findings are good attitude if brow corresponds to the side. Second maneuver that contain the elbows and knees. Poor attitude if examining fingers will meet an abstraction in the same side as fetal back. Hyperextended head also palpates infant's antero-posterior position. If brow is very easily palpated, fetus is at posterior position or occiput pointing towards woman's back.
Listen the fetal heartbeat of the baby with a stethoscope.
Assume that the baby is cephalic. Therefore, fetal back is located on the lower right abdomen. Listening to the fetal heartbeat will help us determine whether the heart rate is normal or not and will help us prevent further complications.
Count the fetal heart rate for 1 full minute. Place the client in a comfortable position.
Placing the client in a comfortable position will help her promote comfort and relaxation.
Do aftercare and document all findings.
Doing aftercare will help prevent cross-contamination, and documenting all findings will serve as evidence or documenting means done.